Neurosurgery is my first love. And I always knew that when I was in a medical school that I can only be a surgeon. And then came, what kind of surgeon? I was very intrigued by brain in general. And then when the idea came to operate on somebody, a human's brain, where even a millimeter of error can cause devastating consequences to the patient or the family, I chose that, that kind of a tight spot to train myself, that let's go for something which is that kind of difficult. So the special expertise is what we call as the skull base and the endovascular neurosurgery. Skull base meaning that I can go to the deep location of the brain, which are difficult to go by usual routes, and do the surgery over there. Endovascular is to basically treat the complex brain vascular problems by using the radial and the groin axis. Let's say 25 years ago, when a person used to have a ophthalmic artery aneurysm. When I say ophthalmic artery aneurysm, it's the aneurysm near the optic nerve, okay? And for that, the surgery used to be very complex. You have to cut open the brain, take the special part of the bone out, and then you clip the aneurysm, and there's a chance for having a deficit for the optic nerve. Everything was very high. Patient would stay in the hospital for weeks, maybe months, if there was a complication. Now we have this technology because of the endovascular, and I can treat the patients. They can come in the hospital during day, just like any other surgery, and they walk home next day. I have followed only one thing, that I will do what is in the best interest of the patient and not in my interest. So that's my biggest policy is, and if someone comes to me, I'm going to advocate the treatment or not treatment in his or her own best interest. I'm passionate about my profession, actually. So from my endovascular neurosurgery, the fact that it's kind of a responsibility that the patient has given it to you and the family, that they trust your hands and your heart, actually, more than that you will do the best for them, for their family. And it's not just patient's life. Around that life, the life of several people revolve. It's their wife, their kids, their parents, their siblings. So it's not just one person I see it, anything complication, anything bad happening, it's not going to affect just him, but his entire family. It could be a life-changing experience, not just for him, for the entire family. So I understand that responsibility that they have given it to me. So I'm very passionate about what I'm going to be doing for them. Whenever you're getting up in the morning, it's not that you have to go to work is like some kind of an option. It is something which you signed up for. So you have to go get up, give the best shot, and just try to see this as a completely new day. Just forget what happened yesterday, what complication you had, or what good day or bad day you had. A new day is a new day, and just live in the moment and give the best to the patient. That's it.